Welcome to Exam Sale. In this short guide we break down the syllabus for the HESI Admission Assessment Exam, the HESI A2, so you know exactly what to study and how to prioritize your time. The HESI A2 covers 7 domains with precise weightings: mathematics 20%, reading comprehension 15%, vocabulary and general knowledge 15%, grammar 15%, anatomy and physiology 15%, biology 10%, and chemistry 10%. Most items are a mix of conceptual and scenario-based questions, with reading heavily scenario-based. Use the percentages and suggested learning hours to plan a focused study schedule. Mathematics accounts for 20% of the exam, is rated medium in difficulty, and has an estimated learning time of 25 hours with conceptual and scenario-based assessment. You will master basic mathematical operations like addition, subtraction, multiplication and division, apply order of operations, and solve simple equations. Expect to practice fractions and decimals, ratios, proportions, percentages, and unit conversions including metric, household measures, temperature conversions, military time, rounding, estimation, and mental math techniques. Reading comprehension makes up 15% of the test, is medium difficulty, and has an estimated 15 hours of study with scenario-based assessment. You will learn literal comprehension skills such as identifying main ideas, locating supporting details, and sequencing events. You will also develop critical and inferential reading skills like making logical inferences, distinguishing fact from opinion, identifying author tone and purpose, and evaluating the strength of arguments. Vocabulary and general knowledge is 15% of the exam, rated easy, and recommends about 12 hours of study with conceptual and scenario-based items. This domain builds academic and basic medical vocabulary, familiarizing you with common prefixes, suffixes, and roots that appear in healthcare education. You will practice identifying synonyms and antonyms, applying high-frequency words in context, and distinguishing commonly confused words and terminology related to health and wellness. Grammar represents 15% of the exam, is rated easy, and suggests around 10 hours of study with conceptual and scenario-based questions. You will review parts of speech and sentence structure, learning to identify nouns, pronouns, verbs, adjectives, and adverbs and to apply subject-verb and pronoun antecedent agreement. You will also practice mechanics and usage such as correct apostrophe and comma use, fixing dangling and misplaced modifiers, capitalization rules, spelling, and common homophone errors. Anatomy and physiology is 15% of the exam, rated hard, and requires the largest commitment at about 40 hours with conceptual and scenario-based assessment. You will learn general body organization and terminology, including anatomical planes, body cavities, levels of organization, homeostasis, and basic tissue types. You will also study systemic anatomy and physiology across the integumentary, skeletal, muscular, nervous, endocrine, circulatory, lymphatic, respiratory, digestive, urinary, and reproductive systems and grasp how these systems function and interact. Biology comprises 10% of the test, is medium difficulty, and recommends about 20 hours of study with conceptual and scenario-based items. You will cover cellular biology topics like cell structure, organelle function, prokaryotic versus eukaryotic cells, cellular respiration, ATP production, photosynthesis basics, transport mechanisms, and enzyme function. You will also study genetics and molecular biology including DNA and RNA structure and replication, mitosis and meiosis, Mendelian genetics, transcription and translation, and basic taxonomy. Chemistry is 10% of the exam, medium difficulty, and suggests about 20 hours of study with conceptual and scenario-based assessment. You will review atomic structure, periodic table trends, isotopes and ions, and how to identify metals and nonmetals. You will practice chemical bonding and reactions including ionic and covalent bonding, polarity and intermolecular forces, states of matter and phase changes, balancing equations, solutions and molarity, acid-base concepts and pH, and basic redox ideas. Use the domain percentages and estimated learning hours to prioritize study time, focusing first on high-weight areas like mathematics and anatomy and physiology while keeping steady practice on reading, vocabulary, grammar, biology, and chemistry. Build a study plan that mixes content review with scenario-based practice and timed questions to mirror exam conditions. Good luck on the HESI A2 and study smart.